to order, and I'll start by reading our mission statement, which is in a new spot on our fresh website if anybody's looking for it. It took me a few minutes, even though it's staring me right in the face. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. We'll move to adoption of the agenda. I'll take a motion.
So moved, Burke.
Support.
Motion from Burke, support from Brian Fantuzzi. Any questions or comments? All right, hearing and seeing none, all in favor signify by saying aye.
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 All opposed? The agenda is adopted. Next is item 4, hearing of the public. Anybody wishing to speak, you have 5 minutes. Please give us your name and address, and it is on any item that is on the agenda. You can put your name in the chat. You can raise your hand. You can speak up. Hearing of the public going once. Hearing of the public going twice. Third and final call for the hearing of the public. All right, hearing and seeing none, and Dave and Sandy haven't said anything. We will close hearing of the public. There's also another one at the end of the meeting if you missed this opportunity. Next, we will move on to item 5, request to approve. Item 5A is a request to approve the Doximity contract. Take a motion to send that to full board for approval.
Motion to approve.
Motion from
Support, Vosberg.
motion from Selena, support from Kathy.
Question.
We'll let Dave, did you want to speak to this real quick before Nick asks the question?
Actually, Dr. Serpa, did you want to make any comments on this one?
Sure.
Thank you.
Okay, so Doximity is a, some of you might be familiar with, is a telepsych platform, teleservice platform that we looked into because we wanted to move towards the idea of standardizing the different platforms that we'd be using to be able to serve our clients. Before we transition into COVID mode, we were utilizing Zoom. And it seemed like Zoom, from the perspective of IT, created quite a few challenges for the IT department in regards to having to provide the technical service, and also how Zoom was set up in a way that needed different logins in order to be able to have the staff utilize it with the patients when providing telepsych services. Now, COVID came about, and in efforts to kind of get used to the circumstances, the doctors and our staff started to utilize different platforms that all of a sudden were open for the use of for the telepsych or teleservices provision. So we wanted to consider Doximity because it's a platform that is actually developed to target or to the provision of health services. Apparently, after looking at different platforms in conjunction with IT, we felt that this platform was going to be able to get rid of a lot of those challenges that we had with Zoom, which is the utilization of different logins. And basically, this just requires a single organizational login and be able to just allow the staff to have direct access to it when needed. And then the other thing that also IT found very, very helpful as we were looking into these platforms was the fact that Doximity was the only platform that allowed the staff to be able to have IT support without necessarily having to have the involvement of our IT department. So challenges related to, for example, the training of the staff to learn how to use Doximity and to be able to feel comfortable with it. It's something that Doximity as a provider is willing to absorb and takes a load from IT in that sense. So from that perspective for IT, it was very helpful, the fact that Doximity has their own 24/7 support system for the doctors and is willing to take over the training for physicians, nurses, and any other staff that is going to be utilizing it. And it'll help as an organization for all of us to kind of just stay in sync and to have an standard platform that we are going to be able to use to provide the services that we need to.
Thank you, Doctor. Nick, you had a question?
Well, yeah, I guess what concerned me, and I'm going mostly by the background report, is that we picked this because of one doctor recommending it. Did we explore other systems? Was there an RFP? Was there any bidding? Was there, I mean, you're talking about you requiring everybody to use this one service. Does the 25,000 I think I saw is the subscription fee, does that cover the training and the IT support that you talked about, Dr. Serpa? Or are there additional costs?
No, there is no other extra, and I don't know if any of our members from IT are here, but they probably would be able to speak better as far as what was the delineations with the Zoom contract in comparison to this one. But I can say that there was no RFP that was done. Basically, what I did and IT did on their own end was to look at these different platforms that were out there already being utilized. And then I met with IT to kind of find out what their perspective is and whether or not they felt that this, from their knowledge, was probably the best choice. And it was from their end what they believe was a good platform altogether, understanding all the challenges that they had with Zoom. And obviously, I'm sure the circumstances behind how they initially got to establish any kind of business with Zoom to begin with. I understand that happened when Dr. Joseph was the medical director. So all that background work, I don't know, but from the collaboration that I did with IT, their position was definitely in comparison to what they had looked at, Doximity was better. Now, we did get some comments from some of the doctors who are utilizing Doximity right now, and some of our doctors are using, platforms such as, for example, FaceTime and things like that to be able to serve some of the consumers. So the doctors who had used Doximity offered really positive results. We had one working on open access, and we have another one that offers service between open access and also one of our direct providers, and another doctor who's also part of the open access team. So all of them had said that, from their personal experience, it was good. And then that added on to IT to feel more comfortable, and also to myself to feel more comfortable with it. Now, when I looked at the different platforms, I kind of just did my own search online and looked at, what were, how were they fitted to the provision of medical services, and what, what people out there felt in regards to, the ratings that these companies were getting. So that's how basically, obviously initially the intention was to probably meet with a couple of the options, and I brought to IT a couple of the options that I had. But from our meeting with them, IT felt pretty comfortable that comparison to the challenges that they had with Zoom and having to go through that process before that, they felt that it was a good option. And price-wise, I'm sure they can be able to maybe provide a little bit more detail. But my understanding is from my discussions with Thomas that Zoom was going to, if we were to renew with Zoom, the pricing was going to be a lot more expensive. So even from pricing perspective, he felt that Doximity was even a better choice and, wouldn't pose the challenge of being more expensive.
Well, go ahead, David.
I was reviewing some of the background as well. Apparently, the plan is to move away from Zoom, conduct our meetings via Teams, and do the telehealth via Doximity. And it does come with unlimited support, which is easier for the docs to use. Docs were reporting difficulties, technology issues, user issues with our current platform. So this is intended to be a value add on that side and help us in our transition. So we do have Zoom licenses. That was kind of our first knee jerk for the pandemic. Then you'll recall we were able to use some of the CARES Act dollars to expand our technology, and that included those Microsoft updates, which is Teams. And then Doximity is specific to telehealth, meets all of the privacy standards, and it has easier use.
Bill, do you mind if I ask a question, kind of make a statement?
Hold on a second.
Oh,
Nick,
sorry.
are you finished?
Yeah, I'm through.
Okay, I've got Kathy first, and then Megan, you'll be next.
Okay, thank you.
Thank you, Mr. Chair. I had when I first saw it before reading it, I thought, oh, I wonder how this maintains client confidentiality. Well, I don't understand all how it does it. It mentions it 15 times in the document, so I think that's a positive. So I support this and appreciate all the work that went into it. I do have a question about how it's used. FaceTime is kind of an easy thing to use. I'm sure that's not confidential at all. There's all kinds of ways for other people to access that. How does the person we serve approach this to get hooked up with their provider?
Yeah, that's correct. The aspect of Doximity is that from the moment that it was launched, it was developed to abide by all the laws that were in place as requirements for teleproviders before COVID. Now, COVID made things a lot more flexible in order to facilitate quick access, and that's how platforms like FaceTime ended up being approved, which they weren't before, because all the platforms needed to be HIPAA compliant, needed to have a series of completed requirements to guarantee that there wasn't going to be breaches of confidentialities, or that their platform was not going to be easily hackable, and all of those kind of things. So that's what we're trying to go back to, because at some point COVID is going to resolve, and we are going to have something in place that is going to be like Zoom was, but maybe even better, Now, in regards to the access, that's among the things that we looked at as far as, and those were my points of concern when I was looking through these platforms, was the fact that, we have clients in different kinds of populations. Some of them have access to electronics, some of them don't have access to electronics and don't have cell phones, and one of the things that Doximity through their platform allows is that connections can be even established through a landline in the event that there are no cell phones available for that consumer. And it will also facilitate the scheduling of the appointments, which is something that had been identified as a challenging thing. The capacity to be able to send the links or make that connection with the client at home seems to be a lot more streamlined and organized through Doximity, which is different from Zoom in the sense that in order to create the encounter, when we had a more controlled environment that the patient could come in, Zoom was something that you could just log in and have it in your computer. And then you'll have the patient right in front of you because they had a dedicated room where they can sit down and where you can just establish a connection. But now patients are at their homes. That monitor and control environment is not there. So we had to kind of figure out how to make that accessibility better. And one of the things that I'm strongly emphasizing is trying to make sure that we optimize the use of video conferencing capacities rather than telephonic. Now, we know that given our population, we are going to have to face those problems of having to stick to telephonic because of their lack of access to certain electronics. But at least we are able to guarantee that the electronics don't pose a major issue like they've been posing it with Zoom, because Zoom does not have the capacity to be able to just establish connection with somebody through a phone line. It can only be done, for example, telephonic. It can only be done by a phone that calls in, or by by that direct imaging. So those were the things that were looked into from the concerns of the providers. That the one thing that I was looking for a platform to resolve was that doctors, when they made a connection with the patients with their phones, they were saying, well, my phone pops up and then I get phone calls from that patient directly into my phone, and I would like for that phone call to maybe go to the clinic directly if the patient has anything to add or has another question. They can be rerouted to the clinic rather than coming through my direct cell phone. So Doximity gives the capacity that when the doctor is making that phone call, it is attached to the actual clinic number. Let's say the first resource is North Clinic. When they're making that connection, that number is the one that is going to show up on the consumer's cell phone, or what's the word, the recognition, the caller ID. And then that way they can be able to call back, where they have a question after their encounter related to maybe an appointment or even to the doctor, that it might have popped into their minds after the encounter. Then it can be rerouted through the right channel. So rather than going straight into the doctor's phone and feeling that maybe that their privacy gets a little bit, becomes a little public. So all those things are the things that I personally looked into, given some of the concerns being raised, on both sides, and the challenges being found on both sides.
Great, thank you, Mr. Chair.
Thank you, Dave, and then I'll shoot over to Megan.
Just, I have asked IT to be present at the full board meeting, and they can address some of the technology questions.
Thanks, Dave. Megan, go ahead.
I was just gonna give like my 2 cents. I actually recognize the name. I just saw my endocrinologist through this. And just as an aside, I don't know how often we would do it here. I don't know if there's like a pre-screen before our the individuals who use our services see a doctor. But what I thought was really cool was the medical assistant came on to me and went through all of my stuff. So she came on first, and then from a totally different location, the doctor was able to go on. So if patients need to see more than one person, I noticed, like, I thought that was the most realistic, almost like in-person telehealth anything I've had since COVID started. So it definitely was really cool, and I definitely support it as well.
Thanks, Megan.
Yes, Megan, that's very correct. That's another thing that for some of the doctors who usually want to see, especially our ACT consumers in teams, like the doctor will meet with the nurse and the patient, or for example, with our child population, that gives the ability to be able to connect multiple people on the same visit or appointment time, to be able to have them all informed of what could happen, and streamline that as well. Because with Zoom, you had to have and that was the things about how it did work for us when we first started telepsych, because we had the controlled environment that the staff was in the office and they can just pop in and be part of the image, because everybody was in the same place. But now with people being in different places, it gives the ability to have all the team players present in a single, take. And obviously that's, like you, from your experience, it's very helpful for the patients.
Thank you. Any other board members with Tony? Go ahead.
I have a comment, Phil, when Tony's done.
All right, Tony.
I had a very similar experience that Megan had. I support it too. It's very comfortable. And what I see in general here is that we are about to improve our efficiency and our service for less money. So I like the sound of the whole thing.
Thanks, Tony. Linda, go ahead.
I agree with what Tony just said, and I like the idea that you have IT hanging out on this, because we just want to be sure that, I'm your test case, that it works with all devices and all abilities and all technology and all Wi-Fi speeds. How's that?
Yep, we'll make sure to test it with you specifically first from your cave, wherever you're calling from for our meetings. Any other board members with questions or comments?
Phil, I have a question.
Sure, go ahead.
Has the contract been reviewed by legal?
I believe so, yes. It goes through the smart sheet before it comes to the board.
Okay.
I'll double check ahead of the full board.
Sandy
thank
said yes. Sandy's telling me yes.
Okay.
Just one last question. That's you indicated that you were going to require all of the providers to use this.
Our staff and independent contractors, the doctors.
Yes, it'll be for our direct clinics. I can't speak for, those that are external contractors, because
okay.
they all have developed their own platform. I don't think we can mandate that, but for our direct clinics, First Resources North, all of them, yes.
Gotcha. Thank you.
Sure.
Thank you. Any other board members with questions or comments? All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. All right, next is item B, request to approve RFP for NCQA consultant for NCQA accreditation. I'll take a motion to approve that to full board.
So moved. Burke.
Support Nagovan.
Motion from Burke, support from Nagovan. Dave?
When I started, I believe something like this may have come to the board before. NCQA is the accreditation used by the Medicaid health plans. We do partner with them as under the My Health Link program. It's a step up. It'll focus on our internal structures. It's very much focused on outcomes. I went through it once before. It's a big lift, but it's definitely moving us in the right direction. Integrated healthcare, satisfaction, being able to show results, quality of life indicators for people served. It is an expensive process as well, not so much just going for the accreditation, but the consultation part will be costly. I have talked to Richard. It was in the budget coming forward, but it'll need special approval. But right now, we're simply asking your permission to issue the RFP, see who and who responds, and then we'll be able to share more detail going forward.
Thanks, Dave. Any board members with questions or comments? All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. All right, next is item 5C, request to approve Genoa Consumer Medication Coordinator Agreement. I'll take a motion to send that to full board for approval.
Move to approve Bush.
Support Schmidt.
Linda, support from Selena. Dave?
I tried to assume some questions you might have, and Dr. Serpa was kind enough to get the information here that is in your packet. But we're starting it as a pilot. They propose to be available 2 times per week at our north site. There would be no cost to us. They'll provide their own staff and equipment. They're looking to start next month or March. The intention is to assist with as many people as possible during the day. We're looking at the longer acting injectable psychotropic medication. The synopsis from the person in charge. We do think that the long-acting medications will help keep people stable in the community for longer, which should help on the hospitalization side and on the quality of life side for the people served. It's a dedicated pharmacy liaison who helps with coordination and delivery of medications. It's their philosophy that having a dedicated person on site will improve communication. And improved communication and results in more cost-effective care for the consumer. And like I said, quality of life outcomes. So we would like to enter in this agreement with Genoa with your approval. Dr. Serpa, if I missed anything?
I think you pretty much summarized it really well, Dave.
Well, that was your summary, but I think
I know. This has been a long-term project that we've had with Genoa. We have a very terrific partnership with them, and this would give the ability for us to almost have the expertise of a pharmacist and their knowledge to be able to educate consumers right on site. We really worked baby steps on this to try to understand what kind of demand. That was one of the big things that Genoa wanted to find out from us. What kind of demand are we going to have so that we can be able to, from our end, incur into the expenses that it'll mean to do this. And definitely the numbers, especially with the population that we serve that is in long-acting injectables, was something very appealing to them. So the pilot is going to start with the days where we have injectable clinic days. They're going to help not only in improving the education and among our consumers in regards to medication, but also in a very comprehensive way, tackling medical aspects, medical medication education along with psychiatric, which I think, in our goals to move forward with our strives in integrative care model, I think it's very positive because we have a very complicated population of consumers that really need that extra push in being able to be educated on, on the importance not only of staying compliant with psychiatric, but also medical. As you know, when you go to a pharmacy nowadays, when you're picking up a medication, the pharmacy would ask you, would you like to have to receive education on this medication that your doctor prescribed? Or would you like to know more about this medication and maybe talk a little bit about what your concerns are? Well, that's exactly the kind of service that we are looking at being able to have available right on site as unfolds on our day-to-day operations. And I think it's a tremendous blessing to be able to do that, for a lot of our patients. One of the challenges that we'll also found is that, patients who are on multiple medications sometimes need a little bit of an extra guidance in regards to pill boxes and things like that. And having a pharmacist can be able to help to work through those challenges, can only, help us to be able to help better our clients, our patients. So I was very excited when they brought this idea to me. And like I said, it's taken quite some months to be able to get to where we are and to be able to finally present it to you guys. But I cannot look, more forward to it. Seeing it now that it's only a few months away of being able to actually start happening. So I'm really looking forward to it, and I really you how helpful it could be for our population.
Thank you, Doctor. I have Selena and then Nick.
Thank you, Phil. Dr. Serpa, often we see patients that are in an acute care crisis in an inpatient unit, and we would prescribe a long-acting injection because we do understand that it is the best way to keep them in a compliant state. Sometimes pills don't always work well, or we find that they end up missing doses. When we're discharging, we often see patients that come back because they haven't stopped taking their medication. Will we from the acute care hospital have a way that we can hand out the information to go there if they do miss an appointment? Or will you guys be able to, if we put that into focus, will you guys know that this patient has been started on a long-acting injection, and that in the community we're going to need to follow up with that second dose so that we can kind of wrap their arms around those and they don't miss it and then spiral out of control and end up back in an emergency room?
That's correct. That's exactly what we're looking at, to be able to offer this more comprehensive, array of things lined up to be able to allow to fall things into place rather than falling through the cracks. Yes. Now, I do got to share with the board members that
You cut off, Dr.
Genoa as their pharmacy of choice. We're not imposing or mandating. This is a totally voluntary service. But certainly those are the kind of issues that we're looking at trying to address. By Genoa being part, if the Genoa program is involved with this specific consumer, for example, they will allow to be able not only to have the refill on time, make that connection with our RNs and to say, hey, the hospital gave them this, this is what they should continue, in a way that the hospital is not notified that this specific individual is working in the CMC program and is with Genoa, so that we can close all those loops and pass that information along, but that's basically the idea of helping this population, and trying to give that extra push to them that seem to struggle the most as well.
I think this is a wonderful initiative that you guys are looking at doing it. So let me know how we can assist you guys in making this pilot beneficial.
Yeah, that's great, Selena. I really appreciate that, and certainly, I'm gonna be speaking to, once we start this, we get this rolling and have the staff physically helping us. I think, being able to work on that coordination, it's gonna be very, very helpful for sure. Thank you so much for proposing it.
Thank you. Nick, go ahead.
Two quick questions, and maybe there's a way, Dave, we can correct the system to provide this information like we used to, but one, has it gone through legal? And two, there isn't any place on the signatory for the county exec's office. Now, I understand we're not paying anything, but there could be additional liability beyond, although they're carrying a pretty hefty liability insurance policy, which is good because that's one of the areas where you can create liability where somebody prescribes a medication that is not compatible with some other medication that the individual is taking, or there's an allergy or whatever.
We would be ordering the medication. They would be supplying it, but Doximity did go through legal. We do have a smart sheet system set up where anything
Doximity.
goes over, Aaron reviews it, it goes to program and budget, then full board, then back, well, for my signature and then for the office of the county executive. And I am meeting with
The
the office
general
of,
one, David.
what?
This is the general one, not Doximity.
No, I know, where Sandy is verifying that one too, but I was following up on the question for Doximity. But
Okay.
yeah, we will work on getting a process so it clearly indicates, yes, Corp Council has reviewed.
Okay, and then the contract, I assume, will be amended to include.
Yeah, it always is at the end for the
Okay,
county exec and I both sign.
no problem. It just is, usually it shows that a space for their signature. This time it didn't, so I just want to make sure. Thank you.
Yeah, we'll work on that too for you. Sorry about that.
Thanks, Nick. Sandy just mentioned to me too that the contracts that end up on the agenda have gone through Aaron Thomas. So, but a check mark or initials or something might be helpful. So, all right. Any other questions, comments? Dave, did you have something?
No,
Okay.
all set.
All right. Having a motion and support, all in favor signify by saying aye.
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 All opposed? Motion passes. All right, next is item 5D, request to approve boilerplate fiscal year 2021 with contract appeal language and MHL language. Take a motion to approve that to full board. Move
So
that.
moved, Burke.
Support Phillips.
Motion from Megan, support from Lori. Dave, go ahead.
Well, it's a change in our boilerplate. And we tried to give you the chapter and verse about why those changes needed to be made. And you did get an entire amended contract in your packet with the new language. And Christina's here and available to answer any specific questions.
Dave, any questions, comments from board members?
Just one real technical one.
Go ahead.
There, one sentence doesn't read right, and maybe it's just a typo, but it says to any Macomb County community mental health consumer that might reasonably be expected to is that adversity or adversely? No, it says adversely providers viability. I think
What
you want,
page are you on, Nick?
it's in the yellow highlighted piece, so it's on.
I see it. It's on
50.
page 27. I see what you're referring to.
Yeah, it's on page 27, and it seems like
We did use the language that the health plan wanted, and then we did also put this through Corporation Council. So I think if there is just a typo there, we'll make sure that's corrected and get you guys a final version before it's put in the contracts.
So I think that's probably something that should be read expected to adversely affect providers as opposed to adversely providers.
I agree with you, Nick. We'll make sure that's updated and double checked and then circulate it back through Dave.
Okay, thanks.
Thank you.
Thank you.
Thanks, Nick. Any other questions or comments? Can we get that corrected by full board?
Yeah, I can get that corrected for you tomorrow.
Awesome. All right, just wanted to give the board members some peace of mind.
No problem.
Thank you. All right, seeing no other comments or questions, we have a motion and support. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Next is item 5E, request to approve Flourishing Lives Inc. contract, previously Sensory Systems. Take a motion to move that to full board for approval.
Oh, moved.
I think that was
Support.
I don't know who support was from.
Support Schmidt.
Thank you. Dave, go ahead.
This is, we have had a contract with Sensory Systems. They had a change in ownership and along with a name change. And that's the extent of this contract coming to the board.
Perfect. Any board members with questions or comments?
They provide PTOT and speech services.
Thank you, Dave. All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Next up is 5F, request to approve CNS healthcare contract. I'll take a motion to move that to full board for approval.
So moved, O'Connell.
Support
Support.
Phillips.
Motion from Chris, support from Lori. Dave, go ahead.
This one's a little different. So I met with Sherry McGrill, who's the CEO for Northeast Guidance Center, who we currently contract with, along with Michael Garrett, who's the CEO for CNS. CNS is in Oakland County. They are in the process of merging under CNS. So Northeast Guidance Center will become part and parcel of CNS. In order not to impact existing services and to actually provide additional couple of things. Northeast Guidance Center mentioned looking at a physical location within Macomb County. They specialize in children's services. And we have our indicators are showing need in that area that we can talk more on the 21st. So that's a benefit to our system. CNS tends to specialize more on the adult case management side. So I think it's a good benefit to our county, and we do have the need for this. So it's Northeast will go away. We'll have a contract with CNS. They tend to have it completed by October 1st. And this is just kind of getting ahead, and we'll be transitioning them, getting them used to our systems over this period of time.
Thanks, Dave. Any questions or comments from board members? All right, hearing and seeing none. We have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. Next is item 5G, request to approve service codes addition to MORC contract fiscal year 2020-2021. Take a motion to move that to full board for approval.
Motion to move to full board.
Support Bosberg.
All right, motion from Ryan, support from Kathy. Dave, go ahead.
I'm happily going to hand this one off to Christina.
I thought you might.
Christina, can you?
All right, yep, sorry, I'm just a little trouble unmuting there. Okay, so for this one, it's just an addition of the codes as outlined in the board action request. So we're just adding those services. And the reason for adding is the individuals served have met this level of care, that this is a need that they have, and they have requested these services. The first one is peer mentoring services, which personally I'm really excited about. You may be familiar with peer support specialist, and this is similar, but this is more targeted at the individuals who have a diagnosis of DD. So this is a slightly different, but same certifications and training that they're going to have. So that's a really exciting addition. We don't have other providers doing that. So we were happy to see that be something that they wanted to do. And the other one is the code for, I'm scrolling through, sorry, I had all of them open. So a couple different things. It's for their nurses, more employees, nurses as well. And this is something that they can do with the swallowing needs. A lot of individuals served in our population, significant number with MORC, have needs around their ability to swallow. So they need things cut up very small. They need just liquids. And this is a service code that will allow those nurses to do the assessment or the treatment for that. And the rate was approved by our CFO, and the codes were validated by our coder to make sure that we're implementing them correctly.
Thanks, Christina. Any board members with questions or comments? Selena.
So I do have a question about the Mork contract, because I've always had very big concerns about Mork. Have we gone back and just re-entered into a contract with them based upon the previous contracts? Are we looking at maybe changing it up, renegotiating it? Are we just going to leave it business as usual?
Dave, do you want me to speak to that, or?
I feel you kicking me under the table, Dave.
No,
Well, in short, Selena, their contract is the same as any other providers that has supports coordination and case management services. So they might have a couple additional things with their nurses, and they do still have their CLS services, respite and residential. Otherwise, their boilerplate, all of their attachments are the same as any other provider in our network.
What about the fees we pay them?
I'll let Dave handle that.
The umbrella part of their contract is more on the residential side, which then they have homes that are contracted under them. So when we go to backtrack and follow up on an issue, there's these more homes. I have talked to Dennis directly, and we do have plans to bring all of the I'll call them residential services, but it's the community living supports and personal care in a licensed setting or in the person's own home under our direct contracts. And we will be moving in that direction over this year. It will be a longer term project. But once we do that, then we can tell you that Mork's contract is exactly the same as any other outpatient provider.
Okay, so we should see something holding them to different standards, or we can be looking at bringing some of the services back to ourselves. So is that what you're thinking about doing with the homes? Is bringing them back under us?
Yeah, they would be under our direct contracts. We would contract with the staffing providers for those.
Okay, and then we can hold them accountable, or more so than the way it's been, because I've always had concerns about their homes. I have concerns about their case management. We deal heavily in my hospital with Macomb County, and there are some phenomenal providers that you guys have contracted with that provide care that is above and beyond. And I feel that Mork isn't always one of them.
Yeah, so we are moving forward with those plans, and it's come up in our meeting with the Provider Alliance. It's come up in discussions with Mork and our internal plans as well.
Okay, thank you.
Thank you, Nick.
Yeah, Mork used to be one of them. That's part of the problem, and they were the original group home providers long ago. But there has been some serious problems now. But I guess along Selena's lines, my question is: have we were into a dispute with them on how we paid them at that level? Has that been resolved and/or fixed? Or is that wrapped up in that long-term piece you're talking about? And secondly, I think I'm hearing these questions are not affected by what we do or don't do on this agenda item.
Right, it's not impacted by this agenda. I'm going to plead ignorance on your funding issues. Christina might have some.
You had negotiated out a payment. We were going from fee for service to
from subcapitated to fee for service. Yeah, that happened right as I was coming in. Yeah, I think that's all resolved.
Yeah, we've been fee for service with Mork since I believe it was 2017, 10/1/2017. And Nick, I apologize. It might have been January 1 of 18. I can't recall, because the contract at that cycle, if you guys remember, was split. We had one that went from 10/1 to 12/31, and then one from January 1st to September 30th. And I don't remember if that was why. I'd have to look at it, but I can find that for you and send that over to Dave. But it is all fee for service. And And the changes that Dave's referring to would not be, the individuals served under these codes, it would not impact them in that way.
Gotcha. Okay.
These services would stay with MORC.
Yeah, okay.
We also, informational, Oakland County did this already with MORC and brought all those contracts in-house directly. We've been talking to providers, and we're going to learn from our the predecessor person who did that first, and we're trying not to do it appropriately, carefully.
Thanks, Dave. Any other board members with comments or questions? All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. All right, next is item 5H, request to award Spectrum Community Services with licensed residential contract. Take a motion to move that to full board for approval.
So move, Schmidt.
Support
O'Connell.
Phillips.
Motion from Selena, support from Chris. Dave, go ahead.
The board previously approved the RFP to expand our residential options. Those were all reviewed, and Spectrum came out as the winner of the RFP process. So this is simply a follow-up to that process.
Thanks, Dave. Any questions or comments on this item? All right, hearing and seeing none. All in favor signify by saying aye.
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 All opposed? Motion passes. Next is item I, request to approve attendance for board members at conferences in 2021. Everybody's going to be flying all over the place. Dave, I'll take a motion to approve.
So moved, Burke.
Motion from Megan. Is there support?
Phillips.
Support Bush.
Dave, fire away.
I guess I'll start with an apology. I should have done a little more on this one. It's probably more of a discussion point than an action item. We do have the seasonal conferences from the Community Mental Health Association of Michigan. The National Council conference information is coming out as well. So we do have a line item in our budget for conferences. I can work on, I think it's a gross amount for the entire agency, including board members. But I will work with Richard and come out with, like a board member budget, if that's what you would like. Or we can handle these as they come up, whether or not we can cover them given our current financial situation. Right now, there's really not a problem, and most of these conferences are virtual at this point. I was just notified today, I had registered for National Council last year, and I withdrew. I asked to cancel at the beginning of the pandemic, and then they kind of canceled everything. So they've automatically registered me for 21. So if any of you registered for the National Council Conference, you'll probably be getting that same type of information. We can probably just handle this as they come up going forward.
Any board members with comments?
Dave, I'd like to share the dates of the association conferences. Sandy just sent us the notice to see if we wanted to attend what they call the winter conference, which is February 9th through the 12th. It's 4 days and they're in the morning. And then what was the spring conference is still called the spring conference, but it's in June. And those dates are, I think, just the 14th and 15th of June. And then the fall conference, which might be, they're looking at in person, but who knows what October will bring. October 25th and 26th.
Thanks, Linda. Nick, were you going to chime in?
Once you sign up, once you're registered, the workshops are available. You can access them later too, once you pay for them.
Thanks, Linda. Nick, did you have something to add?
No, I was just going to mention that the spring or the winter one is virtual. I think Linda mentioned that at one point.
Okay, thank you, Nick. Yeah, this year maybe a take one at a time as they come, see how things are going. I think that would probably be best. Any other questions or comments from board members? I guess we can approve the conversation. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Next is item 5J, request to approve CBH 2021 contract MDHHS Amendment 1. Take a motion to move that to full board for approval.
So move, Schmidt.
Support Bush.
All right, motion from Selena, support from Linda. Dave, go ahead.
Okay, this is part of the infamous egrams system. It is specific, I believe, to the SUD portion. The monies were accounted for in our budget. I was able to check that. So I need to go into egrams and approve it, and then the state will forward those funds. It has gone through Smartsheet, and I am working, like I said, with the Office of the County Executive. They do have access to egrams, but we're working to clarify that process too. So this is normal, standard, typical, kind of an annual renewal process. And I will try to pull it up here with detail, but it's way down in the packet.
Isn't this an amendment?
It's let me try to find it.
It's an amendment to our master agreement between the department.
Yeah, it's under the
to a great extent, these are things we don't have much choice in if we're going to continue to
exactly.
operate.
Yeah, this is
Says First Amendment to CMH contract.
yeah. They changed I'm sorry, it's not SUD. It's early on infant mental health and early on for it's an increase of a little over $100,000.
Mm-hmm.
Oh, that's weird. I don't think I had signed that in there. I just printed it off. So that's an egrams issue. Yeah, it's block grant dollars for all of that for a total of $889,000. So there is some substance abuse in there, block grants for mental health, clubhouse, drop-in, Obra, to hodgepodge.
Thanks, Dave. Any questions or comments on Amendment 1? Hopefully the only one. All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
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 Opposed? Motion passes. Next is item 5K, request to approve MCCMH QAPIP. Take a motion to move that to full board for approval.
Motion to approve, O'Connell.
Support Banducci.
Motion from Chris, support from Lori. Dave, go ahead.
Cindy's on, but you had the opportunity to look at our QAPIP, and then we had an evaluation of that was due to back to the state. Cindy and her team did an excellent job with that. There is a requirement that it go through the board process. There's a lot of detail in there. Happy to, like I said, have a study session or answer any questions at any time between Cindy and myself.
Any questions or comments right now from board members?
I have a question.
Go ahead, Tony.
It's on page 149. Although you don't have to go there, it's very short. I'd like to read it. The title is Increase Engagement in Employment Services. Due to the COVID-19 activities, this goal were halted. An RFP was initiated by MCCMH to identify an agency that can enhance support employment activities. Dave or anybody, can you speak to this one? Is it still halted?
We have a interagency cash transfer agreement with Michigan Rehabilitation Services for employment. I did start through our human service coordinating body discussions of Project Search, which is specific to school-aged, close to exiting people with IDD and in their employment services. Employment is near and dear to my heart, and it's something that I want to see more of. We can talk in more detail in our work group on the 21st. But no, it is not. We're starting to go back. Skill building and employment were the primary targets of the pandemic. They were impacted the most. And then there was all the unemployment payments and things like that in there as well. But no, we will continue efforts in this area to increase.
Well, I'm happy to announce that MRS has found something for my own son to do, and it's successful. He's in his second week right now, and it's working. So the door apparently is open.
Yeah, there's new opportunities out there that we need to explore, but then we need that backup. So in case, I start a new job, but then one of my coworkers tests positive, then I have to go quarantine, or if I test positive, or if I start to sneeze and cough, there's all these new factors now we have to build into the model, but we'll work on it still.
And if I can add in there, the evaluation ended in the end of September. So it was through the height of the pandemic. So we're moving forward now.
It was more a summary of last year.
Yes.
Thank you, Cindy. When I was reviewing it, I was making comments back to Cindy and she that were forward thinking. And this document is a summary of last year. So when we look back on 21, we should have hopefully some more positive comments on employment.
Thank you.
Thanks, Tony. Any other questions or comments from board members? All right, hearing and seeing none, all in favor signify by saying aye.
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 Opposed? Motion passes. Next is item L, request to review approved fleet purchases. Take a motion to move that to full board for approval.
So moved, Burke.
Support Bush.
Motion from Megan, support from Linda. Dave, go ahead.
When I started in December of 18, fleet condition was an issue. I've been meeting with the fleet manager at the county And pretty much we have the worst fleet in the county. A number of our cars are unusable at this point. So when we were looking at the budget for this year, I did talk to Richard. We allocated $300,000 towards fleet upgrades. Then with the help of Tracy Smith and some others, we did look at, we've had a change in our need now given the pandemic. So we'll be moving forward, not with replacing everything we had before, but only what we need to assist, like the vans at the clubhouse, and support the vehicles for our ACT teams who are going out into the community. We are looking, if we would have been able to get everything approved, the car models are coming and going. Apparently the Malibu is what the county was looking at. So depending on when this is approved through the full board, when we go back to the county, there is a timing issue, but they're about 3 months out on purchasing and everything else. But we did evaluate the need. We did account for the funds in the current budget. So we're asking for the board's approval to move forward with the county to purchase these vehicles and make them available for our staff.
Any questions or comments for Dave?
Yeah, this is Brian.
Go ahead, Brian.
Dave, do you know who's going to be, are the bids staying within Macomb County? Are they going to go outside Macomb County, or are they going to even go out state?
It goes all through the fleet manager at Macomb County. So I don't have that detail, but I do think I can't even speak to that actually. But
is there any way you could question them on that? Because I mean, the whole aspect I'm thinking is it should stay in Macomb County to get the bids because they're the ones paying the taxes in Macomb County.
Yeah, I do think that's where they are, but I can confirm it with Tammy.
I'd appreciate it. Thank you.
Okay.
Hey, Dave, this is Richard. It's my understanding that Macomb County utilizes the state of Michigan's group purchasing program for these contracts. So I don't think that there's going to be a separate RFP process. That was my understanding.
Oh, right. There's not. They have existing contracts and they'll just look to fill our request.
Do we know if any of those are dealerships are within Macomb County that are part of this, or?
I can ask him.
Thank you.
Brian, from what I've seen come up when we're approving police vehicles and things like that, it's normally in Michigan, and I know they try to get within Macomb, but I know sometimes it goes outside, but I don't think I've seen any that are from out of state. They're at least from in-state, if that helps.
It does, but I know that we've also tried to buy from Ohio and everything else, and I mean, you're the county commissioner. Why are you being buy products from somebody that's not in our county when they're paying the taxes? I mean,
I totally agree with you.
Thank you.
Thanks, Brian. Any other questions or comments?
Yeah, may I address that?
Kathy, go ahead.
Yeah, just to follow up to what's already been said by Richard and Phil. Sometimes the local dealers don't want to participate in the state bid too. So everyone's given an opportunity to bid through that state bid, but not all of them choose to be part of that program.
Okay, that makes sense, as long as they get the chance to bid for it.
Well, can I suggest that we move this to the full board and give Dave a chance to get that information, a better idea of what all that entails? I'm sure Brian would be interested in buying American and so forth and other things in this regard. I know the state has a preference for that in their budget, but yeah, I'd like to hear that as we move along, but I think we should give them a chance to get that information by the full board meeting.
I just sent the email, so I'll let everybody know.
Thanks.
Thanks, Nick. Thanks, Dave. Dave, does this process, so it starts with our board here and then it moves to the Board of Commissioners? Is that how it flows?
Yes, from the meeting I had with Steve Schmagel, anything over the 35,000. So we'll be working hand in hand with the county to go through all of the appropriate steps.
Perfect answer. And we start our committees next month. We just got our committee structures and assignments and all that good stuff. So those will start next month. So the sooner we can get going on identifying vehicles and things like that, the Board of Commissioners can start rolling with it starting February. So
we are looking at, what the options are about the cars we have and trying to get rid of those too. So we're working on both sides of it.
Thank you. Any other board members with questions or comments? All right, we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. Next is item M, residential lease A. Take a motion to move that to full board for approval.
So
to
moved.
approve. Fosberg.
I heard Kathy. and
Support Schmidt.
Okay, perfect. Guessing Dave's not going to do this one.
Tracy and TK are available, I believe.
Yes, I'm available. I think TJ is also on. You should have received an explanation of the one particular lease with an overview of the small increase that's being occurred due to taxes and insurance, and the fact that this home had received a decrease the last lease cycle. We're suggesting that you consider this lease, and I, of course, welcome any questions you might have.
I didn't hear what you said about teacher.
But TJ should be on. You should also receive the report. I'm not sure if he's just able to speak right now. You should also, okay, good. TJ, so I don't know if you want to speak to the report that you provided about all the concerns being taken care of at this home.
Yes, this was a little bit odd in that you don't have all of the detail. And the reason is the provider changed hands in this home in this process. So where my inspection cited the previous provider, they left the home and a new provider came in. And the new provider, and then the pandemic. So there was not a chance to review it. But after speaking with the corporation that is now in there, all of the cited concerns have been addressed with both the provider that is currently in there and the landlord. And the monies that were needed to make the repairs came from the previous provider, if that makes sense.
Sure.
So I recommend renewal of this lease, and everything has been taken care of.
Thank you, TJ. Any questions or comments from board members?
I got one for you, TJ. Did they send you pictures of the fixes?
They did not send me pictures, but I did go in the home. I just made sure that nobody else was in the home when I went in.
All right, because you mentioned the pandemic, so I didn't think you got in a home. All
Yeah,
right, thank you.
there are some rare occasions when I am going into a home, but we're trying to avoid it at every cost, at every turn.
Thank you.
I have a question, please.
Go ahead, Tony.
I know in the past we have not actually put the exact address on these things. What was the reason that we don't call out the exact address?
The reason was to give some anonymity to the folks that live in that home.
Okay? There must have been a good reason, but did somebody breach that or somehow cause a negative reaction?
The previous board, I think, would be better to answer that question, Tony. We had some conflicts that kind of grew out of that.
Yeah. Okay, TJ, did you verify the taxes went up?
I did not, but we
He didn't
received,
personally, but we do. Yeah, we receive proof. So we have a process in which, in order for before we change the contract, they provide us the most recent year's taxes and also the previous year to prove that they paid them.
That's
So
correct.
every year we reconcile the process to ensure if we paid you $300, that you actually paid out that $300 directly in taxes.
Yeah, gotcha. The reason I'm asking is I live in that zip code and my taxes did not go up. Just
Tony, when I say went up, I want to say it was like by $4 or $5. It literally went up by one. The whole thing went up by 1%, with part of that 1% being an increase in insurance.
Yeah,
If you want I don't have in front of it, but if you want the exact figures, I can pull them up.
No. If it's that low, don't fuss. Your time is more valuable in some other way.
Thanks, Tony. Any other questions or comments for TJ or Tracy? All right, hearing and seeing none, we have a motion and support. All in favor signify by saying aye.
Aye. Aye.
All opposed? Motion passes. Thank you both. Next, we move on to number 6, receive and file. We'll start with item A, IR annual report and customer satisfaction survey. I'll take a motion to receive and file.
So moved. Fantuzzi.
Support Schmidt.
Motion from Ryan, support from Selena. Dave, did you want to speak to this item at all?
No, and I'm trying to figure out, okay, speak up if that's your area, because who did we have assigned?
It's quality. So basically, this is the annual report for the incidents that we report to the state each year. And our consumer satisfaction survey that we did this past year, we received over 1,000 responses from consumers, even through the pandemic. What it was we changed how we gathered the information. We had the case managers contact the consumers, and they offered them a paper copy. They could talk to them about their satisfaction, and the case manager would write it down. We had a Survey Monkey, which is a computer survey, as well as if they requested, they would have quality call them back and find out where their satisfaction rated at that point. The only item, we had one item that fell below our 80% benchmark. The benchmark is 80% because it includes strongly agree and agree. If people neither agreed or disagreed, it kind of counted against us. So we did pretty well on this survey. One of the reasons we had to change it because the last survey we had, we didn't have any that fell below the indicator, and the Health Services Advisory Group that does our external audit was concerned. They wanted to make sure that we were changing our questions and finding things that people were not satisfied with. So the one thing that they did identify that they weren't satisfied with was that they were able to see a psychiatrist when they wanted to. So we are working on that right now with Dr. Serpa to make sure that whenever anyone feels they need to see a psychiatrist, they're able to get in when they want to. So that kind of explains that. Any questions?
Pretty quiet. Any questions? All right. I don't see any. I don't hear any.
I just want to, Phil, this is Ryan. I
Ryan,
read
go
all
ahead.
the responses. I just want to say great job to everyone. And thank you for following up on the psychiatric services. And you already answered my question. So thank you. And great job, everyone.
Thank you.
Thanks, Ryan. Any other questions or comments? All right, hearing and seeing none. We have a motion and support to receive and file. All in favor signify by saying aye.
Aye.
All opposed? The report is received and filed. Next is item B, the CARF accreditation letter and accreditation report. Take a motion to receive and file.
So
So
moved,
moved.
O'Connell.
Motion from
Support Tony Floa.
Chris, support from Tony. I think Brian was in there for somewhere.
Okay.
Dave?
Give it to Tony.
Yeah. This is definitely good news. We received the full 3-year accreditation from CARF, which is our current accrediting body. Just to try to explain accreditation and stuff too. This was on the direct service side is how we're currently accredited through CARF. What we're looking to do with NCQA is to be accredited as a managed behavioral health organization, or MBHO, but we'll provide more information on that too. I've highlighted some of the areas of strength that the surveyors commented on. I would just like to thank everybody, all the staff and departments that were involved in this. It does touch almost every aspect of our agency. But to give special kudos to Cindy and her quality team for guiding us through this process and for the results that you see in front of you.
Dave, Phil,
Go
to
ahead.
Dave.
Yep.
Tony and I sat in on the exit conference, and I just have to tell you, it's just really, it really is a good experience to be able to hear outsiders come in, view our system, see such wonderful things that they're even kind of astounded that we're able to do. And so, and I know all the work that goes into the report. I imagine the work. So thanks to the staff, not just for being able to do a good job while they were visiting us, but that the things they looked at were all in good order. That's a good work.
Thank you.
Thanks, Linda. Selena?
For those that are new to the board and maybe not understanding the CARF, Cindy has done a tremendous job over the years and has led her team to really good surveys and audits. And, you know, even when we were at our worst and everybody was, you know, the state was, you know, doom and gloom, the state was going to take us over, we maintained a type of quality that other CMHs don't. So that really, you know, really goes out to her and her team and everybody in the office, because we have been having wonderful surveys for many years. And that is the one thing that is very consistent about us.
Thank you. And if I could also say that the direct operated that are under Crystal did a fantastic job. I mean, it was just amazing at what they were able to show, how we operate on a daily basis. And the surveyors gave kudos to Dave and Adam, the board members. I mean, it really was a very positive experience. So thank you to everybody.
Thank you, everyone. Thanks, Cindy. Great work as always. Any other board members? Questions, comments, confetti? Seeing and hearing none, we have a motion and support to receive and file the report. All in favor signify by saying aye.
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 All opposed? Reports received and filed. Next, we'll move on to resolutions. We have no resolutions. Item 8, other possible agenda items. Before we start getting to what's on the agenda, going forward, we are supposed to take a roll call of board members when we have virtual meetings, and I did not do that at the beginning of the meeting. This is what happens when I don't put stuff on the agenda. So I'm going to ask Sandy to read off everybody, all the board members' names. Please say you're present remotely in some way, shape, or form, and the municipality, county, and state that you are in. So I will turn it over to Sandy to do the roll real quick.
Okay, Megan Burke.
Okay, of course, the first one. Phil, I'm sorry, do I say where I live?
Wherever you're at right now for the
Right
meeting.
now.
Yep.
Okay, Megan Burke is here in Chesterfield Township in Macomb County, in Michigan.
Linda Bush. Linda Bush.
I know you're muted.
I had to unmute. Linda Bush, Harrison Township, Macomb County, Michigan. Is that all?
Yep. Yep. Nick.
Nick Shimtero, I'm here in Roseville, Michigan in Macomb County.
Ryan.
Ryan Fantuzzi, I'm here in Clinton Township, Michigan.
Dana is not here. Phil.
Phil Kraft attending remotely, Chesterfield Township, Macomb County, Michigan.
Brian.
Brian Goldman here remotely, Macomb Township, Michigan. I mean, yeah, Macomb Township in Macomb County.
Chris.
Chris O'Connell attending remotely from Washington Township, Michigan and County of Macomb.
Okay. Lori Phillips.
Attending from Macomb Township in Macomb, Michigan. In my home. Macomb.
Tony.
Tony Plua, attending remotely from Shelby Township, Michigan, Macomb County.
Selena.
Selena Schmidt attending remotely in Shelby Township, Michigan, Macomb County.
And last, Kathy.
Kathy Vosberg, attending in my home office in Chesterfield, Michigan, Macomb County.
That is everyone, Phil.
Thank you, Sandy. And thank you, Kathy, for the reminder. We will be on top of it for the full board in 2 weeks. I know Kathy will be. Next real agenda item is 8A, discussion of 2021 CMH board meetings, dates and times. Dave, did you want to kick this off? No?
It's up to the board members about the when you would like to meet, days of the week, time of day. There was a concern. The Board of Commissioners had yet to set their meetings, and when we do start meeting in person again, since we use their space, we will need to schedule around that. Other than that, I don't have any details. Sandy, do you have the commissioner schedule?
I hope she doesn't, because I don't.
No, I was going to say Phil is the one you need to talk to about that.
The only thing that we've decided at the Board of Commissioners is that we are going to stick with the 3 p.m. time slot. We don't have days set. So if we continue doing what we're doing here at CMH with 6 o'clock meetings, I think we'll be fine.
Why are we considering changing our meetings? Did I miss that? Why?
Just in case the commissioners had changed their schedule,
okay,
we'd have to work around it. But if they still meet during like normal business hours, and if our board still prefers to meet in the evenings, we should be fine.
And if I remember correctly, the Open Meetings Act requires us to put an annual list of anticipated meetings. Obviously, you can change them or add or subtract. So do you need a motion on this or just need to? I mean, I think what we're doing is fine, which is the first and third Wednesday of the month at 6 o'clock for program budget and full board, and then others as needed.
Kathy, go ahead.
I agree. I agree with you need.
I would suggest that we have asked Sandy to prepare a calendar that matches the same type of calendar we had for the 2020 year with the days of the month already mentioned, and then include a couple other things that we've had historically, and we could have that at the full board to approve, because we do need to approve an annual calendar.
support that.
And we usually make some adjustment if the Thanksgiving days are weird, you know, or the Wednesday night is the eve, and sometimes at Christmas.
We'll bring a proposed schedule to the full board for everybody based on the typical second and fourth Wednesday at 6 and adjustments for holidays.
Correct. Okay.
That sounds good. All right, we will close the discussion for the board meetings. We'll look forward to that at the full board. We will move on to item 8B or C. We'll give Dave a break. We'll move on to B, CFO report from Richard. Yes, we'll take a motion to receive and file his report.
So moved.
Support.
Motion from Brian. All right, Richard, go ahead.
All right, so we have our first monthly finance report for fiscal year 2021, so October. Just a couple of highlights and a whole bunch of disclaimers. I'll start right off the bat by saying we are still closing our fiscal year 2020 books in preparation for final reports that go to the state of Michigan at the end of February. So numbers related to last fiscal year are still subject to change. For our payment trends, we are seeing that our revenue is above what we were receiving this time last year and above what we were receiving at the end of September. Now, it's a little tricky because you see the spike that happened in September. Just a reminder to the board that that spike has to do with 3 months of BCW payments received in September related to July, August, and September. So again, a little bit of a variation there. The other thing I'll remind the board is we do get 6 months of retroactivity for our revenue and our eligibles. So even though this number is already higher than last year, it will continue to grow as we get those additional payments. This is a combination of the additional eligibles, which we'll talk about in just a moment, but also we did get a small rate increase in October compared to last fiscal year. So it's a combination of both. Moving on to the eligibility, also we see this kind of steady trend that happened at the end of last fiscal year, which is the blue line, and we are above that. Again, this is anticipated with the current policy that individuals are not being disenrolled from Medicaid due to delays in Medicaid eligibility reconsiderations. So that's a known factor that's going to keep our eligibility higher than it otherwise would be. The state of Michigan did take this into consideration when they set the rates. They are anticipating that sometime middle of this fiscal year that policy would potentially change. We don't know a date that will change yet, but that could negatively impact our eligibles, and associated with that would negatively impact our revenue from that point forward. So just something to be aware of as we're looking forward. Again, it's the first month of the year, so not a whole lot of data to see trends yet. So we'll keep our eyes on that. Any questions on the revenue or eligibility that we're seeing for October? Hearing none, we'll move on to the comparative charts. And this is where I get, again, a lot of disclaimers that the information related to September 2020 is not complete at this point in time. We are keeping consistent with our previous reports, and we are using it as comparatives, but there is final accruals that are still taking place, as well as final cost settlement reporting that has to take place with the state of Michigan the next couple of months. So the big items that we see is cash and investments being significantly up from the end of last fiscal year, and vendor payables being significantly up. from the end of last fiscal year, a lot of that having to do with, both of those having to do with a lot of the additional revenue being received for some DCW at the end of last year. And then we're still in the process of getting all of that DCW paid out as we move forward. Moving on to the comparatives for the income statement. Again, a little bit more comparable, but again, these October 2020 numbers are annualized. And whenever you annualize off of only 1 month of data, the smallest variations or timing differences that could have occurred in that 1 month, they get compounded over 12 months. So again, as we get more months of information into the financials, those variations will start to smooth out and we'll see less of those. In general, if we were to look at 12 months, our capitation would be slightly lower than last year. The big thing here is we don't have any of our retro payments for October in this number yet. So as those payments come in, we do anticipate that our total revenue received in 2021 will be greater than the prior year. Similarly with provider services, we are anticipating that we will have more expense in provider services for 2021. But again, it probably will not be as significant of a difference as being shown here because we're having 1 month annualized. And so it probably won't be the full $20 million difference that we're seeing here. That will be a little different. So again, little timing differences in 1 month of payments get compounded due to that annualization calculation that takes place. As we move on to the comparison by fund source, as we look at Medicaid, our Medicaid surplus then for the first month is about 3.5 million, autism 300,000, for a surplus in Medicaid autism combined of just under 4 million. Healthy Michigan, a surplus of just under $1 million. State General Fund, a surplus of just under 300,000. And then at the bottom of this, we have updated this for our estimated beginning balance of both the Internal Service Fund and the Medicaid savings. This beginning balance is based on the projected FSR that we submitted to MDHHS in November, which shows us fully funded in both the risk reserve and savings at 34.7 million. Again, because our final reports are not due until the end of February, that beginning balance is subject to change based on final reporting to the state. Those are our highlights for our October finance reports. The November finance reports will be available at the full board. And so again, some of these pieces of information will change slightly between now and then, but I'd be happy to address any questions or concerns that the board might have at this time.
Thanks, Richard. Board members, any questions?
Once again, Richard, a very fine report. Again, this another great report, and it makes me feel comfortable that we've got services we don't have to be concerned about, as we were back in 2016. Frightening year. Thank you.
Thank you.
Thanks, Tony. Any other board members, questions or comments? All right, seeing and hearing none, we have a motion to receive and file. All in favor signify by saying aye.
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 All opposed? The report's been received and filed. Next is our CEO report. Dave, take a motion to receive and file before he gets going. Give him another breather.
Motion to receive.
Support, McGovern.
Motion from Lori, support from Brian. Okay, Dave, go ahead.
Well, at this point in the meeting, a lot of the information has already been covered, but I did receive a question about the status of our mobile health unit. It is back in Michigan. Thanks to TJ. He did the road trip again. The internal modifications are complete. Cynthia is now working on the graphic, the wrap that will go on there. So we'll get some mock-ups and things like that. And I'm not sure about the time frame for that, but we are working as quickly as possible. We are also working with the other county departments and letting them know that we do have this available, given the need for vaccines and outreach into the community at this time as well. We will also be beefing up our the specific schedule and program, and we'll be sharing that with board members as well. We had a meeting at the end of the day today. Cynthia is spearheading our annual report process. We're making good progress on that, and should have a working draft available for your review in the coming weeks. I'll put it that way. We will be sharing it with the CAC members as well. And it's intended just for posting and distribution into the community. Wanted to mention the new hospital process that Tracy Denton is spearheading for us. What we're trying to do is with our inpatient psych hospital partners, get a specific day and time or days and times when our staff would be able to meet with the inpatient hospital treatment team to discuss the Macomb County folks currently at the hospital. It's intended to, we want dedicated staff assigned to each of the hospitals in order to improve communication and the communication around the person's discharge, their transition into the community. We do think one, it can't hurt, but hopefully it will go beyond that, and we can see a decrease in the recidivism rates. So the number of people going back into the hospital within 30 days. National literature review has shown that improved communication actually impacts recidivism. And that's one of these key performance indicators that we report to the state on a quarterly basis. But also, again, it should improve the experience of the person who is experienced an inpatient episode and kind of ease their transition back into the community. So we'll keep you posted on that. At the state level, they did approve the $2 an hour direct care wage increase, continuing that through the end of February. You all approved continuing it through the end of March. So we do intend to do that for the month of March, and we're letting our providers know. There was a comment that the state may do more through an appropriation budget, but we have to wait and see for that. The governor did approve House Bill 5832 for crisis stabilization units. So the state's looking to stand up a number of these units across the state to meet the needs of people in crisis. And apparently they want them to be kind of open for everybody, and then they'll filter them, direct them appropriately if they do present at those locations. They have locally here started with Common Ground and in Oakland County. I forget the other one. Selena, you could help me out.
Yeah, both of the pilots will be, it would be Oakland County with Common Ground, and then the other one is in the UP.
Oh, UP.
Mm-hmm.
The state has contracted with Pine Rest for some inpatient psych beds for COVID positive people, an 8-bed unit. If there was some delays and things, They are also looking at adding some adult foster care step down COVID positive facilities at Pine Rest.
That opened this week.
Oh, good.
Yeah, and they have 16 more beds on reserve if the state should need them.
It is getting critical on our provider side. We met with the department on Thursday. My counterparts around the state were all on board. We had locally a provider with a number of people who live there testing positive, staff people being hospitalized or having to work longer hours. We went into crisis mode. The staffing provider went into crisis mode and reached out to trigger the state's crisis staffing protocols, but they didn't get any help. I brought that up at the meeting last Thursday, and there is the ability for me to trigger, I don't know, a super emergent response. So we've informed our providers of that ability. But the Pine Rest option might help us out. And really, we're crossing our fingers and just trying to support our providers as much as possible through this pandemic as it stretches out. We did get a number of K95, KN95 masks that are intended to be distributed through all the CMH SPs to all of the adult foster care homes, whether or not they're contracted with us or not. So we received those Friday afternoon. Tracy Smith is helping coordinate along with Christina that distribution through our current providers and to all the homes here in Macomb County. So there's a lot going on. At the state level, they did sign and approve the universal credentialing, also for a statewide database. Hopefully that will relieve some of the administrative burden on our side. Probably not, but what'll happen is if I get credentialed in Macomb County and then I end up working in Oakland, they'll be accepting of my credentialing and I won't have to kind of repeat that. So as we're bringing staff in, it should help on that regard. They did also approve the Prtf Bill. It's a psychiatric residential treatment facility for children. They approved it, but it still requires federal waiver approval. The state's looking at setting up, I believe, a couple of these facilities that would be for children. And again, it would be part of the continuum, less than an inpatient psych hospital, but with some pretty intensive treatment and staffing available to them while they were there. They vetoed the certificate of need bill for psych hospitals. I think that's what it was. And let's see. Oh, and we're also assisting the county with the vaccine rollout. So the health department reached out, and again, through Tracy Smith as chief of staff, she met with and has been coordinating the availability of our nursing staff to assist the county's efforts in getting those vaccines out as they become available to us as well. So,
David.
Go ahead, Nick.
David, on the vaccine issue, are our folks being treated as the same as other medical professionals, or as the same as our residentials treated the same way nursing homes are, or is that completely different category?
We have supplied a list to the health department of all of the frontline staff who are engaging people closely. So that's our nursing staff, some of our docs who are seeing people face to face, as well as then all of our the staff in the residential facilities, the adult foster care homes, and people working through any of our staffing agencies or fiscals to provide those community living supports. We have supplied those spreadsheets to the health department to aid in their distribution.
Providers. What about contracted employees?
Yes, our docs are contracted employees as one example.
No, I mean, what about like where we have a residential home that's not, we're not staffing it, we're doing it through a provider?
Yeah, our staffing providers, we gave them all that information. Tracy, did I miss anything on that?
Yeah, but just to clarify, the providers you're talking about in the homes, it's my understanding that the federal government arranged services through Walgreens and CVS for anybody who was on the list in partnership with the state of Michigan in a nursing home or an adult foster care home. So the list Dave is talking about, yes, we gave a list to the health department, but it was more just a check. In other words, our current home should already be able to utilize the Walgreens CVS approach, where they actually come to the homes and have clinics for them. So we're trying to work with the health department just to make sure everybody's on the list. Because if you miss the list, then we need to make sure that you understand that you can go to the health department and not necessarily through the CVS Walgreens route.
Yeah, well, I've got two questions there, Tracy. One is, okay, that's the staff, including the direct care staff?
Yeah.
Yes, it is the direct care staff, yes.
The residents?
I was told when I asked the health department that if a resident was brought to the health department, right, like I'm the direct care worker or I'm the person working in the home and I'm being vaccinated, if they brought them with them, they would vaccinate them at that time. But they never clarified. The health department was not able to speak whether on Walgreens and CVS was going to do the whole home or just the staff. So I don't want to misspeak.
Well, since they expanded this thing to 65-year-olds, which I qualify, the health department is completely out of vaccine, is what they're telling us, at least through this week. So do we have any idea of how many of our provider staff and how many of our residents have been vaccinated, or we're just telling them, here you are, go for it?
Yeah, I don't think we'd be able to speak to specific numbers. I know the county would be able to tell us how many numbers that they have. They currently this week announced that they have 3,900 vaccinations that they make, and the appointments fill up within an hour to an hour and a half of them becoming available. So what we tell everybody is make sure to go to the Macomb County website, and they will constantly have it abreast of the current status.
Well,
and you
yeah,
can make it a
they're starting to take appointments now on the website because the telephones have crashed.
Right.
Not surprisingly, quite frankly. I'm just trying to figure out, because of the priority status given to healthcare workers and to residents of nursing homes, whether that definition included direct care staff, which you said it did, and included residents in group homes, adult foster care homes. And I think I heard you say yes.
I think to your point, yeah, in theory with the Walgreens CVS, but I don't want to misspeak about that. And then to your point, if they were 65, they would meet it regardless, right?
Well, the 65-year-olds now are, that's a relatively new change, but but the original priority group were people in congregate.
Yeah,
right.
And I'm just trying to determine whether or not a group home is considered in that priority as in that congregate living home.
They are. If you go to the state of Michigan's definitions of that setting, they meet an adult foster care home meets the equivalent of a nursing home.
So we're still having problems with rollout and availability of vaccine. That's a health department issue. But in terms of priority status, all of our workers and all of our residential care, people who are in residential care are in the priority status, assuming that we can get the materials out, and then we're using our nurse staff to assist the mental health, the public health folks in terms of actually doing the vaccination.
Correct.
Gotcha. That's great. Thank you.
We are directing our providers, and everybody will have links on our site to connect to the health departments. They have a very good, robust website here with a lot of information. And because things change so frequently, this is your best source, other than going to the state of Michigan or the CDC website.
For
A lot of activity, a lot of kind of a rough rollout for sure.
yeah, I'm trying to see that this is, oh, and this is on the county website.
Yeah, this is the health department, Macomb County, the health department,
Right.
Vaccine Central.
But it circles you back to the state site that circles you back to the county. So that's such a disservice. That 188 number that it tells you to go because they're out tells you to go back to the county. It's really unfortunate. It's very unfortunate.
Yeah.
Right. Well, my understanding is they're going to start taking appointments. I don't know if it is on this site that you've brought up yet, but that they're going to start making appointments by online rather than just by phone. I don't know if they've started that
They
yet.
did, Nick, on Monday when they opened it up, or the appointments were taken both online and the phone.
Okay.
But it crashed. It crashed immediately after it opened, and the phone line got the Verizon. Don't get me started. Let's just pray. Let's pray somebody sends the county some vaccines.
Yeah, that's the biggest problem, is getting enough doses.
Right. That's my report.
Thanks, Dave. Any other questions or comments for Dave regarding his report? All right, seeing and hearing none. I took a motion to receive and file. All in favor signify by saying aye.
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 All opposed? Dave's report's received and filed. All right, a reminder, CMH Board Work Group revenues on, I can't, it's been so long, I can't even speak anymore. On revenue spending will be Thursday morning, 8 a.m., January 21st. And are there any other board members that have any other agenda items before we move on? All right, hearing and seeing none, we will move on to the hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Can be on any topic. Give us your name and address. Wave your hand, speak up, put your hand up. Anybody from the public? Anybody from the public going twice? Third and final call for hearing of the public. All right, seeing and hearing none, we will close the hearing of the public, and I'll take a motion to adjourn.
Motion.
Motion from everybody, support from.
We're all anxious.
All in
Support from
favor?
everybody.
Bang the gavel.
Bye, everybody. See